let's give us one or two use cases to highlight what you guys have been able to do at Asante Health with your data over the last couple of years since you put this program in place.
So one of the ones that comes to mind is, again, a simple example, but our problem list. So the problem list is something that's used by the inpatient docs and the ambulatory docs. It's commonly used, but it's commonly used incorrectly. So what ends up happening is folks are seen by their doc and they get this ever-increasing problem list that becomes increasingly inaccurate. And it's one of the strange aspects of having an EHR versus a paper record. With the paper record, there was this, I'll call it a natural attrition that happened with the problem list. The doc would have to actually write the thing again, and unless it was worth it, they wouldn't actually write it. So stuff that was old or irrelevant wouldn't make it onto the newest problem list. But in the EHR world, it just gets pushed forward. And there's not really a lot of standards about what actually constitutes a problem and when a problem should be resolved or removed. And the reason why this is so important is because a lot of our registries are based on the problem list. It asks really simple questions like, is the patient alive or dead? And if they're alive, is X problem on the problem list? And if the answer is yes, they go into a bucket on a registry. So getting that wrong has a lot of implications. But we put together a team about a year ago, and it has 6 ambulatory docs and 6 inpatient docs coming together to work the problem. And they've met every month since then, and they put in place policy and procedure, and they've evangelized change around what qualifies as a problem and what doesn't. And it's really been terrific to watch that process move forward. So that's, I would call that a win in our box.
No, that's great.